Ultimately, I think it looks like it always should have been there. It's essentially filled in what was a gap and kind of harmonized my face. As I'm getting a little older and losing a little bit of volume in my face, and I think having a little bit of aging kind of dragging my face down, that my forehead has looked a little larger proportionately. So have I actually lost any hair?
Of course, with age, the hairline recedes. Your hairline has receded around 2 to 3 millimeters. Our job would be to restore your hairline today, bring it a little forward, and concentrate more hair in your forelock.
Can you tell me a little bit about the process today?
We're just going to lift your hair from the back, and the rest we're going to pull down. We are going to cut hair from there, and we're going to extract hair one by one. We're aiming to do around 1,000 to 1,200 grafts.
One of the things we've chatted about before is the level of discomfort.
Initially, we'll give you some painkillers before the procedure. Then I'm going to give you a local anesthetic, which will numb the local area. Once the first few needles are felt by you, after that, your head will be numb, so you won't feel any pain. It might be just a little discomfort for the first few days, but there shouldn't be any pain.
The things that you'd be worried about with something like this would be that it would look abnormal, like a straight line across your forehead.
For the hairline, because we're just extending your hairline, we use very fine hair anyway. The hair will start growing after a couple of weeks, and they'll just look like baby hair, and they'll naturally blend in with the hair that's already growing. So that shouldn't be a problem. Only the first couple of weeks you need to be worried about the cosmetic appearance. After first 2 to 4 weeks, they'll just blend in. We start by taking pictures from all angles. It helps with a better aesthetic outcome. After your photos are taken, we lift a small lock of hair, not bigger than the size of a credit card, shave it in a way that it is hidden behind the rest of the hair, as you can see here. I'm just going to show you the donor area, which is now hidden. Are you happy with it?
Yeah, absolutely. I can't see anything at all.
After changing into a sterile and comfortable gown, you'll be then brought to the operating room, where your scalp will be disinfected, and you'll be given a few injections in the scalp to numb the area. In addition, you'll also be given some antibiotics and painkillers to prevent from infection. The surgery started in the donor area. This is done by using a special motorized punch, which individually extracts hair from the scalp. These hair are then placed in a special solution. All this process is completely pain-free. The donor area later grows hair back normally within 4 weeks. After the harvesting is complete, we move to the recipient area, which is remapped, and a few numbing injections are introduced again. In this stage, the surgeon makes thousands of small, tiny incisions at specific angles in your scalp. The depth of the incisions and the angles are very important, because the outcome of the hair transplant surgery and how the grafts grow depend on the incisions. And now we take the harvested hair and place them in the tiny small incisions one by one. As you can see, this step is completely pain-free and comfortable. Rachel, so it's been 10 months since your surgery now. How are you feeling in yourself, and how are you feeling about the results?
It makes such a big difference. We've probably gotten a good inch forward, and it's blended in really nicely with the hair that was slightly more forward on my forehead. Ultimately, I think it looks like it always should have been there. It's essentially filled in what was a gap and kind of harmonized my face. And this is essentially all new hair now. This bit is kind of how far it's grown out. It tends to move really nicely with the rest of my hairline now. It tends to kind of shift just as the rest, and it's curling in nicely. Because my face just looks more proportionate, and I kind of wish I had done it sooner.